Could Wegovy or Zepbound lower dementia risk years before symptoms begin? Medical records link both drugs to fewer dementia diagnoses, but oral semaglutide did not slow early Alzheimer's disease in randomized trials. The apparent contradiction has a clear explanation. A drug can fail to slow brain disease, yet still improve blood vessel health, blood sugar control, sleep and weight before dementia develops. Dementia means declining memory and thinking that interfere with daily life. Alzheimer's disease is the best known cause, but it is not the only one. Strokes and damage to small brain vessels can also cause dementia or make existing symptoms worse. Wegovy contains semaglutide, while Zepbound contains Tirzepatide. Both reduce appetite and body weight. They can also improve blood sugar, lower blood pressure in many patients, and reduce problems linked to obesity. These changes could reduce long-term stress on brain blood vessels. That pathway would be indirect. Neither drug has been shown to rebuild lost brain cells or remove enough Alzheimer's proteins to preserve memory. Blood pressure treatment offers a useful comparison. It cannot reverse an old stroke, but it can lower the chance of another stroke. Early findings made brain protection look possible. Animal studies reported less inflammation and fewer Alzheimer-like changes. Diabetes trials later recorded fewer dementia diagnoses with related weight loss medicines. Medical record studies found similar patterns with semaglutide and tirzepatide. One medical record study followed people with type 2 diabetes who started semaglutide. New Alzheimer's diagnoses appeared less often than with several comparison medicines. The pattern justified stronger testing because diabetes and blood vessel disease can threaten brain health. Medical record studies also linked tirzepatide to fewer dementia diagnoses than some other diabetes medicines. Zepbound produces weight loss and can treat moderate to severe obstructive sleep apnea in adults with obesity. Treating sleep apnea may improve sleep quality and nighttime oxygen levels, which can affect memory and thinking. Medical records cannot prove that either drug prevented dementia. People receiving newer medicines may have better insurance, closer specialist care, earlier weight loss, or different heart and blood vessel risks. Researchers can adjust for recorded differences, but differences missing from medical charts may still make the drugs look protective. The comparison medicine matters. A drug may look protective against one diabetes treatment, but similar to another. That pattern can reflect who receives each prescription, how sick they are, or how often doctors evaluate their memory. It does not automatically reveal direct brain protection. Randomized trials reduce uncertainty by assigning the medicine or an inactive pill by chance. This makes group differences in health and care less likely explanations. This design better tests whether a drug slows an existing disease. Two large randomized clinical trials enrolled 3,808 adults with early Alzheimer's disease. Participants had mild memory impairment or mild dementia and confirmed amyloid buildup in the brain. Amyloid is a sticky protein associated with Alzheimer's disease. Researchers measured change over 104 weeks. Participants received oral semaglutide or an inactive pill daily. The target dose was 14 milligrams. The trials did not test 25 milligram Wegovy tablets or weekly Wegovy injections. These results address treatment after Alzheimer's begins, not prevention before symptoms. Researchers tracked memory, problem-solving, personal care, and daily independence. They also measured whether mild impairment progressed to dementia. These outcomes reflect changes patients and families can notice, rather than relying on a scan, blood test, or spinal fluid test result. Oral semaglutide did not slow worsening in memory, thinking, or daily function. It also did not delay progression from mild impairment to dementia. Both trials produced nearly the same result, despite weight loss among many participants. The laboratory findings were mixed rather than clearly positive. One blood marker of inflammation fell, but key Alzheimer's-related blood markers did not improve consistently. Two markers associated with brain cell injury rose slightly in some analyses. None of these changes produced a measurable memory or thinking benefit. The lack of improvement argues against semaglutide as a treatment for early Alzheimer's disease. The trials still leave prevention before symptoms unanswered. Laboratory changes alone do not show that Alzheimer's disease slowed. Treatment and prevention therefore require separate answers. The trials asked whether oral semaglutide could slow diagnosed early Alzheimer's disease. They did not test whether earlier treatment could prevent dementia from blood vessel damage or delay memory and thinking problems. No completed randomized trial has yet shown that Wegovy or Zepbound prevents dementia in symptom-free adults. Prevention studies would need large groups, long follow-up, and careful tracking of memory changes, strokes, sleep problems, serious illness, and death. Prevention remains possible because several proven effects matter to brain health. Lower blood pressure and steadier blood sugar may protect small brain vessels. Treating sleep apnea may improve oxygen delivery and sleep quality. Maintaining mobility and heart and blood vessel health may support independence with age. A separate randomized Alzheimer's trial of liraglutide produced mixed results in 204 adults without diabetes. Its main measure of how the brain uses sugar for energy did not clearly improve. One thinking test and several scans showed better results with liraglutide, but daily function did not improve. Liraglutide findings cannot be transferred directly to Zepbound. Tirzepatide acts on two appetite-related hormone signals and often produces greater weight loss, but that does not guarantee stronger brain protection. Zepbound still lacks a completed randomized dementia treatment or prevention trial. Animal studies cannot fill that gap. Mice may show less brain inflammation, fewer abnormal deposits, or better maze performance. Human dementia develops across decades. It reflects aging, genetics, blood vessel injury, sleep, hearing, education, and social conditions that animal models cannot fully reproduce. Because prevention remains unproven, patients who qualify for obesity treatment should focus on proven weight and health benefits. Better diabetes control, lower heart disease risk, and effective sleep apnea treatment may also support brain health. Any dementia benefit remains uncertain. Family history alone is not evidence to start either medicine. Neither drug is approved to prevent or treat dementia. Starting treatment only because a parent had Alzheimer's disease adds cost and side effects without a proven reduction in personal risk. Age and frailty, meaning reduced strength and slower recovery, can change the balance of benefits and risks. Nausea, vomiting, and reduced appetite may cause dehydration or poor nutrition. Rapid weight loss can include muscle loss, worsening weakness, and falls. Extra appetite suppression may harm an older adult who is already losing weight unintentionally. Memory symptoms also require their own medical evaluation. Depression, sleep apnea, hearing loss, thyroid disease, vitamin deficiency, medication effects, and strokes can mimic or worsen memory and thinking problems. Using a weight loss drug as an experiment could delay treatment for a different cause. Someone already living with dementia needs extra monitoring when these medicines are used for obesity or diabetes. A caregiver should monitor food, fluids, weight, bowel symptoms, medication use, strength, and falls. Diabetes treatment may need adjustment when food intake decreases. Dementia headlines should not determine the choice between Wegovy and Zepbound. Compare expected weight loss, diabetes status, sleep apnea, heart disease risk, side effects, cost, and access. The ability to maintain muscle and adequate nutrition also matters, especially in older adults. Semaglutide did not slow established early Alzheimer's disease, but those trials did not settle prevention before symptoms. Tirzepatide has less direct evidence on dementia prevention or treatment. Treat obesity for proven benefits and protect muscle. Also, control blood pressure and other stroke risk factors, and evaluate memory changes early. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.